Welcome to Empowered Health. As always, we have a wide variety of important topics on today's show to help you take charge of your health.
Today, we're going to touch on another unconventional option for pain management.
And later, we're going to get into some gluten-free baking with an almond flour cake.
You know, I'm looking forward to that one. But before we get to it, we're going to meet Kim Wood, who uses surfing to help deal with her health challenges. Take a look.
It's so much fun. It's something that is, you're not attached to tubes and machines, and it's not medication. It's, getting out in nature, and it's physically helpful, but it's also so peaceful. It's like the best meditation that you can ever get, just getting in the ocean.
For some, swimming is fun. But for Kim Wood, swimming in the ocean is a vital part of treating her cystic fibrosis.
Exercise is really important as well, to obviously keep us strong, but also to help loosen the mucus in our lungs and just get it out.
But let's back up a bit. What is cystic fibrosis? Well, it's a genetic disease that affects the lungs and digestive system.
It causes a buildup of mucus in the lungs and lining the digestive system. So it's just dealing with chronic lung infections, and we can't absorb all of the nutrients from protein and fat and dairy.
But it wasn't until she took a trip to Australia that Kim fully realized the incredible health benefits of salt water.
One of the things that I learned over there was that people with CF who surfed did incredibly well, and the reason was the salt water.
Kim also found that swimming not only helped with the mucus in her lungs, but also helped with the chronic sinus infections associated with CF.
Getting in the water and really, dunking my head and, getting a good sinus flush that way was really, really beneficial.
In addition to swimming, Kim follows a high-fat, high-protein diet, takes upwards of 30 pills a day, and has a 2-hour, twice-a-day regimen of inhaling antibiotics.
We have to do hours and hours and hours of kind of health maintenance type stuff, because if we don't, our bodies just won't function.
So for Kim, swimming in the ocean, which she does several times a week, is the perfect combination of leisure and health maintenance.
One of my first times I went in the water, it was snowing, and I got some pretty strange looks from passers-by, but it was fun.
Coming up on Empowered Health.
Is warm milk your ticket to a good night's sleep? It certainly seems to work for babies. Is warm milk your ticket to a good night's sleep? It certainly seems to work for babies. It works for a lot of adults too. But for a long time, people thought that the amino acid tryptophan helped you off to dreamland. Let's call that the turkey effect. Turkey has quite a lot of tryptophan, relatively speaking. And there's no question people do fall asleep after Thanksgiving dinner. It turns out though, you'd have to eat 40 pounds of turkey to get an effective dose of tryptophan into the brain. And no one can do that, except possibly my brother-in-law. The reality is that big meals and holiday weekends make people sleepy, not turkey. Milk contains much less tryptophan than turkey, so scratch that theory. The most likely explanation is that ritual and comfort help late-night milk drinkers nod off. On the other hand, there may be some foods that are keeping you awake. Aged cheese and preserved meats contain tyramine, which can have a stimulating effect on the brain. Its cousin tyrosine is found in cocoa and chocolate. The evidence for their effect on sleep is not very conclusive, but you might want to avoid them all if you have trouble turning off the chatter in your head. Alcohol. I know, when you drink, you can go to sleep pretty fast. But alcohol does a couple of things. It disrupts REM sleep until you sober up. And when you do sober up, your brain tries to catch up by dreaming furiously just before you wake up. Plus, small amounts of alcohol have a stimulating effect on the brain. So as you sober up, there's a good chance you'll also wake up. Raw garlic keeps me awake at night. There isn't much science to explain or even support my theory, but a study at the Chinese University at Hong Kong found that abstaining from garlic and ginger as part of a Shaolin mind and body regimen showed good results. So let's just say further study is required. Some people suffer if they eat a fatty or spicy meal before bed. I'm not one of them. And there isn't much research to explain the effect, except possibly that you'll get heartburn. In most cases, insomnia is a psychological phenomenon, which makes it a perfect disorder to treat with a comforting placebo. So if warm milk helps you get to sleep, that's your treatment. You don't need science to back you up. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Alan Gottlieb, Executive Vice President of the Canadian Chiropractic Research Foundation and recipient member of the Order of Canada.
Building research capacity means that we put in place some strategic programming, and that programming allowed us to partner with federal agencies, for example, the Canadian Institutes for Health Research, Manitoba Health, and some of the most prestigious universities across Canada. These are chiropractors trained according to university standards, and they're now in place and they're undertaking credible research. And credible research that withstands the scrutiny of the scientific community.
This type of research increases awareness of chiropractors' expertise and allows us to take healthcare to the next level by partnering with other healthcare providers and researchers.
By integrating the profession into the university environment, chiropractors who are trained researchers are able to collaborate with other faculty members. And for example, if we have a research chair placed in a faculty of medicine, that chiropractor is then able to collaborate with the medical people in that particular faculty.
As a result, we have been able to broaden the interest and approach we take to the research of the spine and related subjects.
Now, we have experts in 4 different areas. The neurophysiology area, we have epidemiology people. These are the people that are working to improve population health. They analyze health services data, and they've been tremendously helpful as well. But we also have Greg Kotchak type researchers, the biomechanics people, and then we've got this guy, a cellular and molecular biologist at the University of Toronto.
This is research that leads to new treatment, cutting-edge technologies, and integrative approaches in clinical practice, benefiting the patient and our healthcare system as a whole.
You know, I guess my vision extends beyond what the 7,000 clinicians are looking at, because they're focused on how do I get my patients better. But I'm looking 10 years down the road is how do we raise the platform of the profession? How do we create new chiropractic knowledge and integrate that new chiropractic knowledge with these researchers into the health research system, but also into the healthcare system?
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Today we are going to show you how to perform and progress a deadlift for your simple fitness tips.
The deadlift is a very challenging and functional exercise. It uses multiple muscles over multiple joints. All right, Simona, we're gonna start you in the standing position with your feet about hip width apart. Good. I'm gonna place a stick on your back to represent a neutral spine. 1, 2, and 3. Good. You're gonna draw in your core, and as you squat down, I want you to keep the bar close to your thighs at all times. Once you get to the knee, stop. This is where you start to squat down into a chair. Perfect. Exhale as you come up, and stop at the knee. Great job. Next, she's gonna thrust her hips forward while standing tall. And squeeze those glutes. Nice job, good. Remember not to hyperextend the back too much, so engage that core. Let's go ahead and try that again. Bring the bar down, stop, and you're gonna sit down in a chair. Perfect. Exhale as you come up, and thrust the hips forward, standing tall. Nice job. All right, try this out. We'll see you next episode.
After the break.
You have to be very cautious with cosmetic contact lenses. In general, there are risks that come with a contact lens. You definitely increase your chances of having an infection by having a different object placed on the surface of the eye.
Welcome back. Today we're talking about Ferroblock cloth for pain management. Apparently you could use this cloth for just about any type of injury.
Well, that's something I really want to learn more about, Michelle. A cloth for pain management sounds really interesting.
All of a sudden they were gone.
Terry's talking about menopause-related hot flashes. She was hit hard with them. They were agonizing and lasted for a year. And as they got worse, her doctor said there was a chance they might never go away.
Well, it was wicked. I would wake up in the middle of the night and I, feel like I was on fire from the inside, and I had a hard time sleeping. And then during the day, same thing. Like I'd be, working, and all of a sudden I'd be like dying because I was so hot.
Believe it or not, one of her friends recommended Ferroblock, a fabric used for pain management. Ferroblock has been successfully used to treat amputee phantom pain, arthritic pain, fibromyalgia, sports injuries, and muscle soreness. But hot flashes?
I was sleeping through the night, so I felt better. I wasn't getting them during the day anymore. I did try drugs a couple of times, but I really wasn't, I don't like to. And this was wonderful, so it worked without drugs. I have it underneath my sheet on my bed. At the beginning, I had it doubled under my sheet. And then once they went away, I just lied it flat single.
This is how it works. By wrapping the painful area with a layer of Ferroblock fabric, you shield your body from high-frequency electromagnetic fields, which can cause irritation to nerve endings, causing pain. With Ferroblock, Terry has found relief from her hot flashes without the use of drugs, and she couldn't be happier.
It made my life a lot more pleasant. It made people's lives around me a lot more pleasant, and so I've just been using it ever since, and I really truly believe in them now.
Spooky! And we're not talking Halloween here. We're talking cosmetic contact lenses. They look fun, but as Vincent Price says, beware.
You have to be very cautious with cosmetic contact lenses. In general, there are risks that come with a contact lens. You definitely increase your chances of having an infection by having a different object placed on the surface of the eye.
Well, first things first is the red eyes. So your eye might look green, but the whites of the eyes are going to look a lot more red. So it's a trade-off. Which way do you go? Do you want to have red eyes, or do you want to have nice, clear white eyes that are natural colors? So that's kind of the trade-off. Red eyes is usually the number one complications.
Not all lenses are created equal. The difference between contact lenses prescribed by your optometrist and some cosmetic lenses are huge.
One of the things that I struggle with the most when it comes to cosmetic contact lenses as a practitioner is the fact that it's really quite an unregulated system. So you never really know where you're going to be getting those lenses from and what different standards they've been made to.
They are not made of very good materials. They don't let oxygen pass through the eye very well, so they do suffocate the eye. So repetitive use of that can have lots of complications. Underlying things that people won't notice is the cornea starts to swell. Inflammation into the cornea, and that starts to distort your vision. And that's something people don't notice until the damage is too far gone.
When you do that, you actually promote additional blood vessels to grow onto the surface, which can actually make it so that your body will eventually say you can no longer wear contact lenses. It's going to cause a chronic irritation to the surface.
So, if you're going to wear cosmetic lenses, always get a prescription from an eye care professional and avoid inexpensive costume lenses that don't fit and are not made with breathable materials.
If you are going to introduce something to the eye where it's actually going to reduce the oxygen permeability, be cautious in how you're using it.
Some things are not meant to be put in your eyes. Keep the costuming to fangs or wigs and save your eyes. Coming up on Empowered Health.
So we're going to make an almond flour raspberry ginger cake.
This cooking and nutrition portion brought to you by Save On Foods.
Now, who doesn't like desserts? And when they're healthier, they're even better. Registered holistic nutritionist Julia Olton is going to share one such recipe with us today. Julia, welcome to Empowered Health.
Thank you for having me. So we're going to make an almond flour raspberry ginger cake. So we're starting off with a little bit of butter.
Okay.
And we're going to grease the pan here, the
pan.
cake pan. We've melted that butter on the stove. Is just take it and make sure you cover all parts of that pan.
Grease it evenly.
And I'll just chop up a few bits of this ginger. This is Australian candied ginger. It's very good. So we're going to put the raspberries in here, if you wouldn't mind. And we're going to put, the sugar we're using today is an unrefined sugar, cane sugar.
Okay.
So it's not as bad as the highly refined
It's not as
white,
much processed, exactly.
Correct, sugar. So we put this in. We're going to put a bit of sugar. Now, the recipe calls for 3/4 of a cup of sugar. I'm going to put a little less in there. We're going to put some vanilla.
Okay.
And we're going to put a little bit of water. And so the idea of this, you do this part first. And what you're trying to do is put enough liquid in here to have the sugar actually melt. And you can see that
it coats all the raspberries.
Coats all the
evenly.
raspberries. And I might add just even a little bit of lemon just to give it a little bit of a hint of lemon in there.
Right.
And we're going to let this sit to have the sugar melt and turn into a syrup, and we're going to make the batter up. Okay, so we're just going to put this aside here for now. So I've pre-measured the ingredients in here. So again, we have half a cup of sugar, we have some all-purpose flour, we have some almond flour, baking soda, and a little bit of salt. And what we're going to do is we're going to mix this up. I'm going to put a bit of ginger in here because I didn't remember to do that. And then we're going to put 1/3 of a cup of milk and an egg.
So this is dairy milk?
This is dairy milk, yes.
You could use
a cow. But you could use almond milk
as well.
You could use rice milk. And we don't want to add a whole lot of liquid to this. It'll look a little almost like a biscuit consistency, but it will spread in the pan. So we're going to mix that up. I would probably add a little bit. You don't want to add too much because there is a bit of syrup from the raspberries that ends up in the cake. And so if you put too much liquid in this cake batter, it's going to affect.
Yeah.
So you can see it's kind of almost muffin-like consistency.
Yeah.
Okay.
And put it all on here.
And it won't look like it's going to spread, but it will.
Okay.
And then what we're going to do is put the raspberries on top. You might think this is going to be a bit of a problem, but it really isn't. Once you add the raspberries here, it makes a big difference. Is you just kind of place them over the middle here, and you leave about 3/4 of an inch around the edge.
Around the edges, the
cake around the edge is able to rise. I think that's probably good, or it's just going to fall apart when you serve it.
Right.
So what we do is we take this and we put it in the oven at 350 and we cook it for 40 minutes.
40 minutes.
So we'll just stick it in here. I have one in here that is already cooked.
That's pre-made?
This is pre-made. So you'll see how the batter has come up and totally
It's actually risen.
It.
Exactly.
Yeah.
True. I'm going to taste it. Let's see. Oh, this is so good. This
I'm
is
glad you like it.
Amazing, truly phenomenal. And it was a good call cutting down on the sugar.
I think so.
Well, thanks for being on the show, and thank you for another amazing recipe.
Thank you.
See you again.
Yep.
A lot of people are following a gluten-free diet these days, and they're all not necessarily gluten intolerant or celiacs. Let's talk to registered dietitian Crystal Higgins to find out, is gluten-free diet really a better option than a regular conventional diet? Crystal, welcome to the show.
Thanks, DJ.
So a lot of people are turning gluten-free, and a lot of gluten-free products are popping up in stores. Are they really better than the conventional products?
Well, for those of us that are celiac or do have a gluten intolerance, yes, they are 100% a better choice. But there's a lot of buzz around gluten-free, and for those of us that are adopting it just to try it, it's really important to look beyond the gluten-free label on the package and actually look at the ingredients, what's in it. I mean, are the first couple ingredients sugar or refined flours? If that's the case, then I would put it back on the shelf and look for things that are more wholesome, like quinoa, brown rice, and maybe even some fruits and veggies.
Fruits and veggies always seem to come in, don't they?
Yes, they do. And when it comes to baking, they can be very easily incorporated. For example, grating carrots or zucchini, you can simply do that and just incorporate it right within the mix.
So, and that was veggies. What about fruits?
So things that you could add fruit-wise would be dates, and dates are great for naturally sweetening our baked goods. And things like applesauce are great for reducing the fat and also providing a little bit of sweetness. For example, if your recipe calls for, say, a cup of butter or a cup of oil, just use half the amount of fat and the remaining is applesauce. And you still get some nice flavor, moisture, and texture.
Well, that's a fantastic idea. What about gluten-free flours? What are the options there?
Right, there's a few different options. There's a lot of baking mixes that you can get now, and the baking mixes usually have a combination of different flours, so things like chickpea, potato, tapioca, sorghum, or if you're after a muffin that doesn't have any grains in it, you can use coconut flour or almond flour.
Almond flour?
That's right, almond flour. And you can even make your own almond flour at home by taking blanched almonds and putting it in a blender or food processor and just pulse it a few times.
Well, that's definitely news to me. I'm going to try making that flour tonight.
You should, but be careful because you don't want to blend it too long or else you're going to end up with almond butter. So
I don't mind almond butter either.
Yes, always a good result.
So either way, it's a win-win situation.
It is a win-win situation, for sure.
Well, Crystal, thank you for taking the time to talk to us. Nice to have you on the show.
Nice to see you again.
Thanks.
Thanks.
Well, that's all for this episode of Empowered Health. I, for one, can highly recommend that almond flour cake recipe.
I can too. I got to try it. It's delicious and nutritious and great texture too.
And it's gluten-free.
Stay tuned next week for more information that will help you empower your health.
And in the meantime, be sure to follow us on Twitter for news and updates. We'll see you again.
Thanks for watching. Bye.